Okay, Chapter 22, Healthcare. The U.S. healthcare system places an emphasis on healthcare being provided by an employer. And this started during World War II because there was wage controls in place. So in order for employers to attract new workers, since they couldn't offer a higher wage, they started offering health insurance. And so it's continued to this very day as being an employee benefit. However, since health insurance leads for the out of pocket cost of the insured to be very low, there's a tendency to overuse healthcare services, which leads to higher prices. And also, the health insurance industry tends to be regulated rather than being replaced with something else. We'll talk a little bit about the Patient Protection and Affordable Care Act that went into law in 2010 and some of its provisions. Okay. So costs have increased immensely for healthcare. This is due to the higher prices of healthcare and also due to the increase in the quantity of services provided in healthcare. So insurance companies over time have provided more and more services as well. And so there's been an increased demand for healthcare, and that's led to higher costs. Plus there's other reasons as well, which we'll discuss later. And so right now costs are projected to increase 5.8% annually over the next 10 years. And then there was a problem that 49 million people in the United States were uninsured. The Patient Protection and Affordable Care Act helped reduce this number through their mandates. Okay, so we can see that from 1960 till present that healthcare expenditures as part of GDP has increased rapidly. We also see here that the United States outspends every nation on healthcare as a percent of GDP. Okay, so United States is here at 17-18%, whereas France, Germany, Switzerland, Canada, which all have a national model, are more about 12%. So the population in the United States is enjoying longer life expectancies. We also have the most advanced medical equipment, technologies. There's a lot of research and development that goes on in the United States that leads to all of this. However, on the downside, the breast cancer mortality rate has not been decreased. Tuberculosis has made a comeback, and there is an AIDS epidemic going on. There's also a lot of talk about quantity and quality. So even though we may have more years, our life expectancies are longer, we may be living those years with a lot more medical problems. This is due to where obesity is rising in the United States, type 2 diabetes is rising, for example, high blood pressure, etc. So when there's high costs, then it's naturally going to deter people who can't afford healthcare from gaining access to care. Also, in the past, before the Affordable Care Act went into place, some employers reduced or eliminated health insurance as part of their packages. Also, there has been slower wage growth because as healthcare costs rise, employers that do offer health insurance will offset that increased cost by not increasing their employees' wage as much as they would have. Also, they hire part-time and temporary workers, since usually most firms don't give part-time or temporary workers any health insurance, and then they'll outsource their employees as well to avoid paying for health insurance. Also, about 1/3 of U.S. bankruptcies come from medical-related expenses, incurring a big surgery such as open heart surgery, brain surgery, or having to go under costly cancer treatment, leads to mounting medical bills. And before, health insurance could drop the patient, or the patients didn't have health insurance, or even they did have health insurance, but due to the amount of treatment they were receiving, the bills just became enormous. And as well, the rising costs have put a strain on government budgets, and they've had to either cut other areas of their budget or increase taxes. The poor are the most likely to be uninsured, and so the Affordable Care Act has helped the poor gain more access to health insurance, because even with their lower wages, private insurance is so expensive that they couldn't afford it. Also, people with low wages but didn't quite meet the Medicaid standard to qualify found insurance too expensive to purchase. And so what happened is the uninsured would wait until they absolutely couldn't refuse medical treatment anymore, would go to emergency rooms, since by law emergency rooms have to treat the patients. And they would seek treatment there, and they couldn't repay back the hospitals, so the hospitals instead increased their costs, or their prices rather, for people that could pay. Okay. So we'll look at some of the supply and demand factors leading to the increase in healthcare costs. One of them is that largely healthcare is considered a right to everyone, and it seems morally wrong to deny anyone healthcare because of their income. Also, doctors, which are the suppliers, tell the patient, who are the consumers, what tests and treatments they need, and the doctor knows much more about this than the consumer. So this can lead to a principal agent problem where the doctor overprescribes diagnostic tests, for example. Positive externalities do result from obtaining health care. So, for example, the more people that are immunized, the less chance that society in general will contract those diseases that they are immunized against. And so sometimes government will subsidize that health care where everyone will want a vaccine, and the demand will increase and the price of vaccines will rise. And health insurance lowers the out-of-pocket expense for people who have it. And so since it's cheaper now to obtain health care, then this leads to demanding more health care, which causes an increase in price as well. Okay. So there's a few reasons why there's been an increase in demand for healthcare. One is that incomes have been rising. So income elasticity in the United States in regards to healthcare is elastic. It's estimated to be almost to 1.5%. So an increase, for example, of incomes of 10% will lead to a 15% increase in the demand for healthcare. So demand for healthcare has been rising faster than incomes have. This is also coupled with the fact that the price elasticity of demand for healthcare is very inelastic. And so as healthcare price rises, demand is relatively unaffected. So even though costs have been rapidly rising the last few decades, it doesn't decrease the demand for healthcare services significantly. So the baby boomer generation started turning 65 in 2011, and that compromises a significant part of the U.S. population. And so, as we know that, the older we get, the more we tend to need healthcare services. So there's a large segment of the population that's demanding healthcare right now. And Americans with unhealthy lifestyles tend to need medical care more as well, so demand has increased due to that. Obesity related medical costs are estimated to be about $150 billion a year. That's quite significant. Obesity is a problem in the United States. Also, doctors play a role. As mentioned before, they are the ones that prescribe tests and treatments. And since they don't get paid a flat rate, what they do get paid for is for each service that they do perform. There's a tendency for doctors, or there's a conflict of interest where doctors, in order to increase their income, may overprescribe exams and treatments. Also, medical malpractice suits are very common in the United States, and they can be very expensive and debilitating for a doctor that gets sued. And so doctors have been demanding higher payments in order to offset the costs of malpractice insurance, or increasing malpractice insurance. Having health insurance leads to a moral hazard problem, and this is where someone that has health insurance may be motivated to be less careful than someone that doesn't have health insurance. So someone might be more willing to drink or smoke because they know that the cost of medical care will be less because they have insurance than someone who doesn't have insurance. And also, they could tend to overuse the health system because health insurance decreases the cost significantly for them. Employers receive a tax subsidy for offering health insurance to their employees. And so employees having health insurance, again, are susceptible to over-consuming health services. We will show the effects of this in the next slide on a graph. Other countries will ration the healthcare provided. They do this through different ways. They can set a limit of expenditure on a person. So, once a person exceeds that limit, then they have to pay out of pocket. And so this would encourage the person to be very frugal with their health care, or they can have long waiting times. Again, so that way it can discourage people who don't have a severe of a problem from seeking health care. In that way, it keeps costs down. But in the United States, it has been the opposite. Insurance has been expanded to cover more services and to not deny anyone coverage. Okay, so in a market without health insurance, we have allocative efficiency, where everyone that desires health care receives health care, and we have our equilibrium price, SPA, and the equilibrium quantity of healthcare services consumed. But with insurance, what ends up happening is demand for health services increases. Drives up the price of these services. However, because insurance covers a significant part of these costs, consumers end up paying this lower price. See over here. So you could see that consumers demand a higher quantity of health services. And suppliers do supply more at a higher cost over here. And so this leads to inefficiency loss from over allocation. In this case, the marginal cost of providing an additional unit is greater than the marginal benefit. So So even though the supply of physicians has been increasing over time, the demand for healthcare services has been increasing faster than the supply of physicians. So this has led to increased healthcare costs. There's also been slow productivity growth in services. It's not like a manufacturing firm where we can find a way to manufacture more widgets within an hour than before. It's hard to find ways to make a service more productive. There's been lots of new medical technology and improved medical technology out there. However, it's increased the costs because these technologies are very expensive to use and to develop. The price of acquiring it's very expensive as well. Okay, so it's a combination of these supply and demand factors that have led to an increase in healthcare costs. Okay, so some ways to help reduce costs. Health insurance companies have started requiring deductibles and co-payments. So since this increases the out-of-pocket expense for the insured, they have less of an incentive to overuse health services. There's also a health savings account. It's similar to a retirement account, except these funds are put away to be used on healthcare expenses. And individuals, when they put money in this account, it's tax deductible, and employers can also make tax-free contributions as well. And so, since people using a health savings account are using their own funds to pay for healthcare services here, they're more likely to be careful about what they consume. Most health insurance companies either operate with a PPO, that's a preferred provider organization, or as a HMO, health maintenance organization. And a PPO is where there's a list of hospitals and doctors that accept a discounted price for their services in exchange for being included in this insurance plan. And so the insurance will reimburse about 80 to 100% of healthcare costs when treated by someone or a hospital in the PPO plan. And to dissuade a patient from going outside of their PPO, the insurance will reimburse less if they choose a provider outside of the PPO. So they are incentivized to stay within the PPO list of doctors and hospitals, and in exchange, the doctors and hospitals will accept a lower fee. Now, an HMO provides healthcare services to a specific group in exchange for a set annual fee. And since physicians and hospitals can actually lose money if they provide too much care, since, again, the fee is annual, they are a little bit more careful about what they provide. However, critics have said that this can lead to lower quality health care. Medicare authorizes payments based on a diagnosis-related group system. And so under this system, a hospital will receive a fixed payment for treating each patient, and that fixed payment is determined upon the diagnosis. But once again, critics worry this will lead to decreased quality of health care. And there's also been talk about putting a limit on malpractice awards. Some say that the limit should be capped at just the economic loss. That way it will reduce medical malpractice premiums, but others will say that having a high potential payout to a patient will give doctors an incentive to be more careful in how they treat the patient. Okay, so in comes the Patient Protection and Affordable Care Act, and this made it illegal for an insurance company to deny coverage to a person because they have a pre-existing medical condition. Before, some insurance companies wouldn't cover someone because of a medical condition that they possess, but it made it illegal. And so now there will be more people that are covered by health insurance. And so the demand for healthcare services will increase. It also does not allow employers to put annual or lifetime expenditure caps on the insured. So they can't stop insuring someone after a certain amount spent anymore. It also requires that employers with 50 or more full-time employees have to buy health insurance for each of their employees or pay a fine. And it also requires individuals to purchase health insurance or they will have to pay a fine. It also covers lower income individuals. They get subsidies to help lower the cost of buying individual health insurance. It's set up an insurance exchange, so for people who are not covered by their employer or don't want to be covered by their employer, they have to buy their own health insurance, and so they can purchase them in government regulated markets. And these are called insurance exchanges. It allows children to be covered under their parents' health insurance until age 26. It makes it illegal for insurance companies to charge any type of copayment or apply deductibles to annual checkups or preventable care. And it requires insurance to spend at least 80% of the money they receive in premiums on either healthcare or improving healthcare. It also, to help pay for this, there was the introduction of new taxes as well. So some of the taxes that were introduced was a 10% tax levied on indoor tanning. This was also meant to discourage indoor tanning since it has a strong link to skin cancer. And then taxes on things sold by medical device manufacturers, an increase in capital gains tax, an increase in the Medicare payroll tax, and a 40% tax payable by employer on any employer-provided insurance policy whose premium exceeds a certain amount for individual cover and another amount for family coverage. So this was a very hot topic in Congress. It seemed like people either strongly favored this act or strongly opposed the act. And so, some of the criticisms was that this would lead to greater inefficiencies in healthcare. As we saw on the graph earlier, that when the price of healthcare tends to be subsidized, that it leads to dead weight losses. The other criticism is that despite there being an increase in taxes, it won't be enough to fully fund the Affordable Care Act. And those who oppose national health insurance said that this is the first step to national health insurance. Okay, so Singapore has one of the best healthcare systems in the whole world. They have one of the highest life expectancies in the world and also the world's lowest infant mortality rates. And so they don't have national health care. But what they do have is that citizens are required to save a portion of their income. And then if they run out of the money in that account, then the government will subsidize their health care. And also prices are kept a little bit lower because competition is encouraged between hospitals. Hospitals are required to post prices of their services. And so people will shop around for hospitals, and hospitals are trying to gain customers. So it leads to lower prices. And since citizens have to pay for these costs out of their own pocket or through their MediSave account, but it's still through their own finances, there's less overconsumption of healthcare services, and that keeps, again, prices lower. All right, this concludes chapter 22, healthcare.